Welcome to World Explorer. The United States stands as the world's leading economic powerhouse, a nation built on innovation and wealth where progress happens every day. Towering skyscrapers shape the skyline, technology drives advancement, and abundance seems endless. Yet on these very streets of thriving cities, thousands of Americans remain without shelter, sleeping in parks, cars, or under bridges. This sharp contrast between unmatched prosperity and widespread homelessness exposes a serious social failure. At Travel Documentary, we present the facts behind these numbers with clear eyes. As you watch, ask yourself, how can a nation so rich allow so many to live without a home? This question demands reflection and action from all of us. The true scale of homelessness in America, official data often underestimates reality. According to the 2024 Annual Homelessness Assessment Report released by the U.S. Department of Housing and Urban Development, there are approximately 771,000 homeless people in the United States on any given night, an increase of nearly 18% from the previous year. However, experts believe the actual number is much higher due to people experiencing hidden homelessness, people who avoid shelters because of overcrowding, fear of violence, or personal circumstances and instead stay in cars, abandoned buildings, or with friends. Homelessness is no longer limited to a few cities or minority communities. It has become a widespread crisis that threatens people across the country. From the bustling urban centers of Los Angeles, where more than 66,000 people are expected to be homeless by 2023, to the 78,000 homeless in New York City, and even small towns where affordable housing is scarce. Many people face the constant threat of losing their homes. For many working families, housing costs have skyrocketed, with median rents rising more than 10% in recent years, outpacing stagnant wage growth. The contrast is striking. The United States boasts the world's largest economy with a GDP exceeding $26 trillion, yet struggles to provide safe, stable housing for hundreds of thousands of its citizens. This contradiction forces us to pause and reflect. If homelessness can affect so many people, what social safety nets actually exist, and how effective are they in catching people before they fall? Social Security and the safety net. Gaps and challenges. Social Security programs serve as the cornerstone of America's response to homelessness, encompassing housing assistance, healthcare access, and nutritional support. In 2023, federal spending on social safety net programs, including Medicaid, housing vouchers, and food assistance, surpassed $1.3 trillion, accounting for nearly 25% of the nation's GDP, demonstrating the country's commitment to addressing homelessness through broad-based support. In recent years, the United States has increasingly embraced comprehensive strategies that emphasize stable housing as a first step in tackling homelessness. The Housing First approach, widely adopted across states and municipalities, prioritizes providing permanent housing before addressing other challenges such as substance abuse or mental health issues. Federal and local governments have expanded coordination efforts among agencies and community organizations to streamline service delivery and avoid duplication. Despite this, systemic challenges remain. Funding constraints persist, political disagreements often stall progress, and fragmented service delivery leaves many vulnerable individuals without consistent support. According to the National Alliance to End Homelessness 2025, over 770,000 people experience homelessness on any given night, with shelters operating at or above 120% capacity during peak times. Access to healthcare and social services remains uneven, particularly for those battling addictions or mental illness. Who is most at risk? Vulnerable populations facing homelessness. While social programs aim to assist all who need help, homelessness continues to disproportionately impact certain vulnerable populations. According to the 2024 Annual Homeless Assessment Report by HUD, approximately 17% of the homeless population are veterans, many of whom struggle with the transition back to civilian life and face higher rates of mental health issues and substance abuse. Elderly individuals on fixed incomes account for about 9% of those experiencing homelessness, often unable to keep up with rising housing costs and medical expenses. Victims of domestic violence represent another significant group, with studies estimating that approximately 40% of homeless women have fled abusive situations. Members of the LGBTQ community face an even higher risk, comprising up to 20% of the homeless youth population, despite representing a much smaller share of the overall population. People struggling with drug addiction and mental health disorders frequently find themselves trapped in cycles of housing instability. The Substance Abuse and Mental Health Services Administration reports that nearly 38% of homeless individuals experience serious mental illness, while about 26% report chronic substance abuse. For many, homelessness is not a choice but the outcome of systemic failures, economic disparities, soaring housing costs, and limited access to healthcare combined with personal hardships to create a devastating perfect storm. On our travel documentary channel, we strive to share these stories as real human experiences, not just numbers. Recognizing the diversity and unique needs of those affected allows for better, more compassionate solutions that preserve dignity. Government actions and policy effectiveness. With homelessness rising sharply in vulnerable populations clearly identified, it is essential to assess how government policies and initiatives have responded to this escalating crisis. Over the past 5 years, homelessness has increased by nearly 15%, prompting federal, state, and local authorities to implement various programs targeting both urgent needs and underlying causes. Notably, the expansion of Housing First programs, now implemented in over 500 communities nationwide, has shown promising results in providing permanent housing and reducing chronic homelessness. Additionally, emergency rental assistance programs during the COVID-19 pandemic helped prevent evictions for millions. And pilot universal basic income trials in states like California and Alaska reflect innovative attempts to bolster economic stability. However, despite these efforts, homelessness rates continue to climb, with the 2024 HUD report indicating a nearly 18% increase in homelessness nationwide. Critics argue that many policies remain piecemeal and reactive, focusing more on managing visible homelessness through measures like anti-camping laws, which often criminalize those experiencing homelessness, rather than implementing broad, preventive, systemic changes. Budget limitations and political polarization further slow progress, leading to inconsistent implementation across states and municipalities. While programs like Housing First deliver positive individual outcomes, the overall scale of homelessness demands a coordinated, well-funded, and multi-sector response. Collaboration between government agencies, nonprofits, community organizations, and the homeless population is vital for sustainable change. The complex causes behind homelessness. The causes of homelessness are deeply complex, involving a combination of economic, social, and political factors. Nationally, housing costs have surged by 15.7% between 2019 and 2023, while median household incomes have risen only by about 5.2% during the same period. This growing disparity severely strains low and moderate income families, pushing many toward housing insecurity. Mental health and substance use disorders further complicate the issue. The Substance Abuse and Mental Health Services Administration estimates that 38% of people experiencing homelessness live with serious mental illness, and 26% struggle with chronic substance addiction. These overlapping challenges trap many in a cycle of instability. Racial disparities intensify these vulnerabilities. Black Americans, who make up about 13.6% of the U.S. population, represent nearly 40% of the homeless population, underscoring systemic inequalities in access to housing, employment, and healthcare. Political debates over healthcare funding and welfare reforms have real consequences, often delaying or reducing access to essential services. For example, Medicaid cuts threaten healthcare access for hundreds of thousands living near or in homelessness. Furthermore, policies focusing on criminalizing homelessness rather than offering support deepen stigma and exclusion. At Travel Documentary, we stress the importance of facing these harsh realities, political, social, and economic, to forge effective, compassionate solutions. The role of society, responsibility, and compassion. Homelessness reflects deep-rooted social and systemic problems rather than being merely a consequence of personal shortcomings. It exists at the intersection of social security systems, economic policies, healthcare access, and community support, all of which highlight a shared responsibility that transcends personal circumstance. The rise in homelessness reflects broader societal challenges such as income inequality, lack of affordable housing, and gaps in mental health treatment. Addressing this crisis requires collective empathy and purposeful action from all sectors of society. Policymakers must prioritize humane policies of society. Policymakers must prioritize humane policies that focus on prevention and support rather than punishment. At the same time, neighbors and community members play a critical role by supporting initiatives that provide stable housing and healthcare access. Grassroots efforts and nonprofit organizations often fill in where government programs fall short, demonstrating that compassion can translate into tangible change. Solution: ending homelessness is a complex challenge that demands bold, sustained, and systemic action. It is not enough to address the visible symptoms. True solutions require deep investments in affordable housing. Equally critical is the expansion of comprehensive health services, including mental health care and addiction treatment. Reforming Social Security systems to provide a stronger safety net and tackling economic inequality are fundamental. The path forward hinges on collaboration. No single entity can solve this crisis alone. Governments must coordinate policies and funding. Nonprofits need to deliver targeted services. Businesses can invest in social impact initiatives. Innovative models such as Housing First offer a blueprint for success by prioritizing housing stability. However, these programs require adequate and sustained funding, as well as the removal of bureaucratic hurdles. A travel documentary, we hope our viewers feel empowered to take part in the solution. Will we confront homelessness as an urgent social crisis demanding collective action, or continue to treat it as a distant problem? The answer lies in our willingness to act with courage, empathy, and unity. Homelessness in America is a complex, growing crisis that touches thousands of lives daily. While progress has been made through social security programs and innovative housing models, significant challenges remain. The issue demands compassionate, coordinated responses from all sectors of society. We believe awareness is the first step toward change, but action is what truly makes a difference. As you reflect on these realities, we invite you to ask, what role will I play? Your thoughts and involvement matter. Please share your perspective and help us foster a community committed to justice and hope.